As a lady, if you are among this category of women I'm about to mention now, then just please wait and listen. You might be at risk of having cervical cancer in the future. By the end of this video, I'll be explaining to you what you can do to prevent yourself from being exposed to cervical cancer. So now, cervical cancer, you might not really understand what it is. Let me briefly explain to the way you can understand that. I don't want to go deep. Yes, cervical cancer is the cancer of the cervix. Cervix, now the mouth of that place, we be say the mouth of the womb. Now be cervix, the womb, and where pikin the day. Now the mouth, that mouth they go open for pikin to come outside. That is the cervix. Sometimes women they develop some kind of cancerous cells. That the cells will be the mouth of that place, that will be cervix. It always increase. You can't they add more. They increase the more and more. And when they increase the more and more, it no good. Now be the cancer we will try to talk about. So I hope I have been able to briefly explain that to you. So now there are things that causes that cancer that we can prevent it as much as we can, as much as possible. That's why we are creating this awareness. Number one, family history is one. If you have any family member who has had cervical cancer, then you are a high risk. So there is tendency. It might not happen, but there is a tendency of it going through running through the family to another person. The next one again that is a risk factor is smoking. If you're a lady and you smoke, you are exposing yourself to unnecessary cancer. You understand? You're not supposed to be smoking as a lady to help yourself, even as a man, so it's not so good. Then the next thing again is your knacking partners. People they get plenty knacking partners. Women with they knack around. It is not good. You are exposing yourself to human papilloma virus. You understand? That virus, that big virus, they affect that mouth of that place. Can't they make the cells to the increase in numbers? You understand? So the more they get that infection, the more you expose that place to that kind of cancerous occurrence. You understand? So any woman will get many knacking partners, they are predisposed to this particular cancer. Now, early knacking is the next one. If you be a woman who say don't start to the knack from small, there is tendency say you go get this cervical cancer because you go don't get all those kind of exposures from when you did small. So it is dangerous. Early knacking no good. You understand? The next thing again, frequent STIs. You be lady where you say you don't treat infection every time you treat infection, every time you carry one infection or the other. STIs from every angle, you will treat infection. There is tendency say your cervix feel get that problem. See if you start to get that kind of cancer, what would they try to talk about now? You understand? Another thing will be another risk factor. Will be say if you cause this thing, I say birth control pills. You get those oral pills. People will do on prolonged birth control. Some women go say they don't do on top contraceptive for 10 years, 15 years. Then they take oral contraceptive, especially. And also other ones, they are also having all those kind of risk. But at least this oral contraceptive is one of the one that is more prominent in the researches that have gone on. You understand? The oral contraceptive, people who don't do on top of for too long, they have high tendency of developing both cervical cancer and breast cancer. You understand? So prolonged use of oral contraceptive is not good. You understand? Now having multiple children is also a risk factor because you don't stress that place. You don't to open that service, don't to stress and bomb. You born 5 and above with the born. Those things, that one is also a stress to the cervix and is a risk factor. Now there is this tablet that they use to prevent miscarriage in pregnant women. They call it diethylstilbestrol. So that if you are exposed to that tablet, maybe your mom used it or anyhow. Your mom used it when she was pregnant for you. They said there is tendency of you having this cervical cancer in your lifetime. That's what they said from the researches. Now, and the next risk factor is low immunity. If you have low immunity, weakened immunity can expose you to human papilloma virus. So That is part of the reason why you should not have your immunity low at all. I made a video previously how to boost your immune system. It will help you to be always strong, so you will not be having several infections because of low immunity. You understand? Now I want to summarize how you can prevent this cervical cancer. Number one, human HPV vaccine. That's human papilloma virus vaccine. If you have it, it will help you. You can go to your doctor to confirm how you can be having your HPV vaccine. Then you also consult your doctor about also having pap smears, frequent pap smears, as often as you can. You understand? Pap smears. Just consult your doctor how they run it in your practicing hospital, the hospital where you take yourself to. You understand? So they would give you information about how they do their pap smears to make sure they rule out any form of HPV. If they notice anything like that, they can treat it on time before it escalates. Then also practice safe knacking. Stop going about meeting different men. It's not good for you. Stop exposing yourself. Also stop smoking for your own good. This is just basically for your own good. And if you want born, try no born too much. If you don't born 3, born pata 4. Try as much as you can to stop for your own good, so you'll be alive to also take care of your children. I hope this video is able to help somebody. Thank you for watching.